All right, welcome back to Morning in America. 10 minutes to the top of the hour here. In your health headlines today, big parts of Robert F. Kennedy Jr.'s vaccine agenda now on pause after a federal judge pumped the brakes. In focus are key changes to the childhood vaccine schedule. And with the federal path stalled, activists are now turning to state lawmakers to push new policies ahead of the midterms. NewsNation Weekend anchor Anna Kooiman joins us now. Hey, Anna, good morning to you. Let's just start with things at the federal level first. What exactly was blocked?
Sure. So there has been a lot of push and pull, hasn't there? The big thing to know is that a federal judge in Massachusetts has temporarily blocked major Kennedy-driven changes to federal vaccine policy. So what does that include? We're talking about the revised childhood immunization schedule and also actions by that reworked federal advisory panel on vaccines. The judge sided with medical groups who have said those moves were made outside the normal science-based process. So for now, that part of the federal vaccine shakeup is frozen, Markie.
Yeah, and families everywhere, myself included, with 2 under 2 at home, are watching closely to what's decided there. But Anna, the administration is blocked from changing some of its more controversial vaccine policies, but it's actually pushing forward in another. What's the latest on that front?
Yes, so this is something that's quite different, though. The Wall Street Journal is reporting that the administration is backing a roughly $200 million cancer vaccine initiative through the National Cancer Institute. Now, these are therapeutic vaccines that are often experimental, and they are designed to help the immune system to recognize and attack any leftover cancer cells in people who have already been treated but face a high risk of recurrence. We know all sorts of people in our lives who have faced that, right? So here's how one doctor explains it.
I know that there's a lot of skepticism for some people around vaccines, but this is very different. This is more of a treatment. I mean, it may be similar in terms of it being an injection or maybe using similar technology, but it's quite different in terms of its purpose. For a vaccination, you're giving a product to a healthy individual to prevent a disease they may or may not be exposed to in the future, versus for a vaccination, immunization, a treatment for cancer. This is a person who has that disease. So the benefits are potentially much, much higher.
So with these two pieces, politically, people may see a contrast or a connection depending how you see it. But medically, we are talking about two very different lanes here. And the next thing to watch is not just the court fight, but also the state fight, Markie, because with the federal path narrowing, as we're seeing here, medical freedom activists who are aligned with RFK are already pushing dozens of bills around the country.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.